I'm Marissa Gilman, and I lead the global health practice at Resonance, a social impact advisory firm. I'm really excited to share with you all my leadership project on inclusive innovation as part of the WomenLift Health Fellowship. I'll tell you a bit about my project in a minute, but first, let me show it to you.
Great, I think we'll go ahead and get started. Hi, my name is Marissa Gilman, and I lead global health at Resonance. You're tuning into the third episode of the Inclusive Innovation Exchange, where we'll explore mPharma's innovative journey in pharmaceutical access. You're tuning into the seventh episode of the Inclusive Innovation Exchange. And in this conversation, we'll chat about novel partnership models to increase access to non-communicable disease care.
Incredible health innovation is happening in emerging markets across sectors. We've seen it easy for innovation to be siloed, where a smart health solution either fails or it doesn't scale because they hadn't figured out how to embed in the health ecosystem. It's complex, and as you can see, there are a lot of players, from academics to startups to governments to multinationals and beyond. That's where the inclusive innovation comes in. It's a thought leadership series and a connection platform for innovators across sectors and geographies in the global health ecosystem. A few colleagues and I created this to combat the siloization that we just discussed, to highlight successes and lessons learned in what we're calling inclusive innovation, defined as innovation that's local first, human-centered, and rooted in partnership, so that it's really embedded across the health ecosystem. Our goal is to inspire and connect these organizations using locally led innovation to maximize their health impact. The Inclusive Innovation Exchange also served a personal goal. I was the only health hire when I started at Resonance, and I hope to find internal champions for global health as well. I got very lucky. I found another colleague passionate about health and innovation, Jay Chikobe, and we built this together. Other people at Resonance got excited about our work, and we added them to our team. The Inclusive Innovation Exchange has now had about 10 episodes where we've featured over 20 organizations, ranging from private sector players like Microsoft and Novartis, to academic institutions like MIT, startups like Clínicas del Azúcar and Helium Health, and bilaterals like USAID, all engaged in conversations that affect us in global health, with topics ranging from supply chain disruption to human-centered design. The Inclusive Innovation Exchange has been one of the highlights of my career at Resonance, and I'm so grateful to have been able to launch it during my WomenLift Health Fellowship. It has served as a connector for resonators to global health. It created leadership opportunities for folks, and it's hopefully created some important conversations for the health community. Within authentic leadership, part of the WomenLift Health journey, I realized something really important, that my strengths matter. I'm good at bringing ideas to life, going from a brainstorm to an executable, replicable program. I've been really lucky to have a co-founder where our strengths complement each other, with Jay being the visionary and me figuring out how to get it done. Within inclusive leadership, I realized how important it is to bring others along our journey. Internally, I got organizational buy-in to embed this as a health initiative, working closely with various internal teams, ranging from our founders to our marketing department. Jay and I then built out a program of guests to amplify innovators' voices in global health, getting them excited about this platform as well. Within strategic leadership, I was reminded that systemic change is really hard. We have been so lucky to have an entrepreneurial and super supportive leadership team, and we launched this program quickly. Guests have been generous with their time and their insights. However, I'm grappling with the question of how to change the systemic challenges in global health that we're uncovering through the Inclusive Innovation Exchange. How do we translate these conversations to actions? And it's an exciting question, and this is our next challenge on IIE. Within impactful leadership, I've realized how rewarding it is to grow with others. This has served as a meaningful way to enable residents, employees who are passionate about health to get involved and for junior staff to flex new skills. In addition, 2 new hires have joined residents after hearing about the Inclusive Innovation Exchange. So I'm incredibly grateful for the leadership opportunities that IIE has provided me, the collaboration that I've been able to have both at Resonance with my team with whom I've built this, as well as with folks in the broader global health community